The Specialist Rehabilitation Centre is a multi-award-winning service situated on the Seacroft Hospital Healthcare Campus. We are part of the Leeds Teaching Hospitals Trust in West Yorkshire. The Specialist Rehabilitation Services are comprised of the Prosthetics Service for North and West Yorkshire, the Leeds Orthotics Service, and the Leeds Wheelchair and Special Seating Service. The combined services provide holistic and bespoke patient-centred solutions in order to help patients achieve maximum functional independence. The services were originally developed in 1927 by the Ministry of Pensions to care for the injured and sick from the First World War. The services were then based at Chapel Allerton Hospital in Leeds, and their reputation was well respected across the UK and Europe. The services transferred to the Seacroft site in 2005, which is where we are based today. These short videos are designed to provide you with an overview of each of the individual services, as well as an insight into how we provide a holistic approach. Many patients require one or more of the services, and this can be accommodated at Seacroft. Seacroft offers one of the largest amputee services in the UK and has been awarded National Centre of Excellence for its holistic approach to patient care. We have also won the National UK Lean Award for Best Practice, Standards and Sharing. We provide a regional service to both the NHS and veterans, and we can also accept GP referrals from outside of the region. On arrival, please report to reception, where a member of staff will check that the personal information they have been given is correct, and they'll inform the appropriate staff that you've arrived. For sensitivity or family support issues, we have a privacy room available. The nurse will check your weight and then escort you to your appointment. You'll meet the team to talk about your needs and identify your goals. The team will discuss with you what type of prosthesis is most appropriate for you. You'll then have either a plaster of Paris cast or an electronic laser scan of your body part. The prosthesis is then passed to the workshop to be made to your individual specification. Some plaster of Paris casts will require additional rectification work. Once the limb is completed, your prosthetist will check the alignment and fitting to ensure it is comfortable for you, matching it as normally as possible to your correct walking patterns. You will get the opportunity to try your new limb, and then you'll require physiotherapy to maximise balance and safety. More established patients may require more specialist prosthetic components. These may need to be aligned in an external environment in order to maximise their function. For further help and advice, staff are available Monday to Friday between 9 AM and 4 PM to deal with any of your questions on 0113 206 3866. Physiotherapy for a patient with a lower limb amputation should start as soon as possible after discharge from hospital. A physiotherapy assessment includes muscle strength and movement of the lower limbs. Exercises will be given to help strengthen the muscles that will make walking with an artificial limb easier. Rehabilitation with a prosthetic or artificial limb includes learning functional tasks like walking up and down stairs. At the start of the rehabilitation, a patient may use a PAM aid within the parallel bars to re-educate standing posture and balance. PAM stands for Pneumatic Post-Amputation Mobility Aid. It also helps reduce edema or swelling, preparing the residual limb for the prosthesis. Most patients find it gives them a boost to walk again. For the more able patients, we have a treadmill and bike. Both these pieces of equipment help improve cardiovascular fitness, but also give the patients a chance to experience fitness equipment before joining a gym. Prosthetists also like to check the fit of a socket while using the bike or treadmill. For patients with a transfemoral level of amputation, The early walking aid we choose is the Femoret. This piece of equipment allows the patient to experience what wearing an artificial limb may be like. The physiotherapist also uses an outside area to practice walking on uneven surfaces so that it's more like real life. This includes walking on sand, gravel, steps and slopes. On Monday afternoons, a ladies' group gets together to maintain their fitness and to support one another. The hour-long session includes a warm-up, stretches and fitness stations. The initial stage of rehabilitation involves 2 sessions of physiotherapy a week for 3 months. After that period, top-up sessions can be arranged if required. For further help and advice, staff are available Monday to Friday between 9 a.m. and 4 p.m. to deal with any of your questions on 0113 206 3639. The Prosthetic Upper Limb Service and Occupational Therapy work very closely together to accommodate patients of all ages. This ranges from newborn babies through adulthood to older people. We're able to advise patients prior to elective amputation, and we also offer advice to prospective parents whose baby has a congenital limb absence identified on a scan. Our aim is to support patients and their families throughout their lives. At our weekly clinics, you'll meet the team, discuss your needs, and identify your goals. The prosthetist and occupational therapist will show you a range of suitable prostheses which could meet your needs. The occupational therapist will discuss with you what activities you need to be able to do at home, at work, at school, and in your leisure time. You will look together at equipment that may help you carry out these tasks. The assessment may also include a demonstration of how you'll be enabled to carry out these activities. The team will then decide if a prosthesis is needed or if a piece of equipment will be required. The prosthetist will measure and cast you for a prosthesis by either taking a plaster of Paris cast or an electronic laser scan of your body part. The prosthesis is then passed to the workshop to be made to your individual requirements. Once the prosthesis is ready, the prosthetist will fit and adjust it onto you. You may be able to take it away on the day, or you may need to return for a final fitting appointment. You'll return after you have worn your prosthesis for a few weeks for a review appointment. At this point, any further alterations can be made. The team will review your goals, and you can discuss any activities which you may be finding difficult to explore possible solutions. For further help and advice, staff are available Monday to Friday between 9 a.m. and 4 p.m. to deal with any of your questions on 0113 206 3866. The Clinical Health Psychology Service is a core component of the holistic prosthetics care provided at Seacroft Hospital. The purpose of the service is to assist patients of all ages in coping with the challenges of limb loss and to make the most of their prosthetic rehabilitation. The service provides a range of different psychological therapies for people who are experiencing difficulties relating to their limb loss. These may include low confidence, worry or panic, sadness or depression, anger, and upsetting memories. Patients may experience self-consciousness, relationship problems, or shock and disbelief. The service also offers group therapy, advice on chronic pain management, neuropsychological assessment, and consultancy to the multidisciplinary team. For further help and advice, staff are available Monday to Friday between 9 a.m. and 4 p.m. to deal with any of your questions on 0113 206 5897. The Orthotics service in Leeds is based over 4 sites, with Seacroft as the main hub. The aim of the service is to provide orthotic treatment solutions to a wide range of conditions, including diabetes, rheumatoid arthritis, and cerebral palsy. Orthotic devices are used to provide pressure relief, correct or accommodate deformity, and to improve function. When you arrive in reception for your appointment, your details will be taken and you will be entered into our computer system to indicate you've arrived. The orthotist will discuss the referral with you and take a history of your condition that requires orthotic treatment. The orthotist will then undertake a thorough biomechanical examination to work out the best treatment choice available. The assessment process may include the use of some of our diagnostic analysis equipment to pinpoint the specific problem areas. When the recommended orthotic device has been agreed on, the orthotist will take detailed measurements of your body part that requires the device. This may be done using tape measures, plasticasts, or our 3D laser scanners. The department maintains a large stock of many different off-the-shelf orthotic devices, so in some cases we are able to supply the device on the same day. If something more specific is required, we send off for this to be custom manufactured. Your prescribed orthotic device will then be supplied with full details of its usage and what to look out for. At this point, we will normally arrange a review to see how you are progressing. We record outcome measures at your review, keeping a record of any progress made, and will alter your prescription as necessary. For further help and advice, staff are available Monday to Friday between 9 a.m. and 4 p.m. to deal with any of your questions on 0113 206 3787. The Wheelchair Centre offers a multidisciplinary assessment service to people of all ages with long-term mobility problems. Clinical assessments for manual and powered wheelchairs, buggies, postural and special seating systems are usually carried out at the wheelchair clinic at Seacroft. At a wheelchair assessment, a member of the therapy team will check that the personal information they have been given is accurate. The Wheelchair Centre holds a range of demonstration wheelchairs. A therapist will discuss with you what type of wheelchair is most appropriate for your needs. This may be a transit wheelchair, which has small rear wheels, or a self-propelling wheelchair with larger rear wheels. The service can provide both adult and children's equipment. The therapist may take you outside to try a wheelchair on different surfaces, which is more like a real-life situation. This may include slopes and uneven ground. Some patients may also be eligible for an assessment of an electric-powered wheelchair that they can use inside their home, or an electric-powered indoor-outdoor wheelchair, which they would use both inside their home and outdoors. Assessments for these type of wheelchairs will involve a driving assessment, both inside and outside, depending on the type of wheelchair that is required. The centre also has a wide range of cushions available, both for comfort and pressure relief. These can be issued to go into a wheelchair following an assessment by the therapist. Seating and posture clinics are available for people with more complex needs requiring bespoke items. If equipment needs to be adjusted, adapted, or modified, then we have rehabilitation engineers on site to do this. General repairs and maintenance to loan equipment is carried out by our service engineers. Where possible, equipment will be issued on the day of an appointment. If this isn't possible, then the equipment will be delivered to your home at a later date by our contractors. For further help and advice, staff are available Monday to Friday between 9 a.m. and 4 p.m. to deal with any of your questions on 0113 206 3855. If you need any further help or advice, then please phone the relevant department. Prosthetics 0113 206 3866. Physiotherapy 0113 206 3639. And occupational therapy 0113 206 3729. Clinical health psychology 0113 206 5897. Orthotics 0113 206 3787. Wheelchairs 0113 206 3855. The Prosthetic, Orthotic and Wheelchair User Group is always happy to give help, support and advice on all issues to both patients and carers. They welcome new members, so please contact them for more information on 0113 206 3265, or you can email admin@seacroftrehab.co.uk. Finally, please let us know how we are doing by completing our quick online survey. You can do this in reception or at home at www.surveymonkey.com/s/specialist rehab. We are always interested to hear what you think of our service. Your feedback is important to us, as it helps us know what we are doing right and ways in which we might improve. Thank you for taking the time to watch, and we hope that you have found this interesting and informative.